Welcome to our Mock Interview Pro series, where today we're focusing on helping you shine as a healthcare aide. This role is all about compassion, teamwork, and communication. Let's dive right into our first question that explores how you work within a healthcare team. Could you share an experience where you worked as part of a healthcare team? What was your role and how did you contribute? Interviewers ask this to understand your ability to collaborate with others to provide excellent patient care. Here are some tips to help you craft a strong response. Think of a specific time when teamwork was crucial for patient care. Clearly state your individual role and responsibilities. Highlight how your contributions positively impacted the team and patient outcomes. Remember to use the STAR method: situation, task, action, result. Reflect on what you learned from the experience to enhance your teamwork skills. Now, let's look at an example. Answer to illustrate this.
In my previous job, I was part of a rehabilitation unit team that included nurses, physiotherapists, and doctors. My role was to assist with patient mobility and personal hygiene. By effectively communicating patient progress, we adjusted care plans quickly, which led to faster recovery times. This taught me the importance of clear communication and teamwork.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Healthcare Aide. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time when you handled a difficult patient. How did you manage the situation? This question helps the interviewer assess your ability to stay calm and communicate effectively in challenging situations. Let's go over some strategies to handle this type of question. Maintain a calm and composed demeanor throughout the situation. Actively listen to the patient's concerns. Show empathy and understanding of their feelings. Use clear and respectful communication. Seek assistance from team members or escalate if necessary. Here's an example to give you a better idea.
I once cared for an agitated patient who was upset about their treatment. I sat down, listened to their concerns, and acknowledged their feelings. I then explained the treatment process clearly, which helped to calm them and build trust. This experience emphasized the power of empathy and communication in patient care.
Describe an occasion when you had to communicate important health information to a family member. How did you ensure they understood? This question aims to evaluate your communication skills, especially in conveying crucial information clearly and empathetically. Here are some tips to effectively answer this question. Choose a specific example from your experience. Clearly explain the health information you conveyed. Describe how you checked their understanding. Mention any tools or methods like visuals you used. Emphasize the importance of empathy and patience in communication. Let's look at a sample answer.
In a previous role, I explained a care plan to a patient's daughter. I summarized the key points and encouraged her to ask questions. To ensure she understood, I used a simple diagram of the plan. I reassured her that her concerns were valid and addressed each one patiently. This reinforced the significance of clear communication and empathy.
If a patient refuses to take their medication, how would you handle it? This situational question assesses your problem-solving skills and ability to handle patient non-compliance respectfully. Consider these tips when formulating your response. Remain calm and respectful. Listening to the patient's concerns. Ask open-ended questions to understand their reasons. Provide information about the medication and its benefits. Involve the patient in discussing possible alternatives, if any. Document the refusal and any actions taken according to protocol. Here's an example of how you might respond.
If a patient refused their medication, I would first ask them calmly to understand their reasons. I'd explain how the medication supports their health. If refusal persists, I'd respect their decision and ensure the conversation is documented according to policy. This approach respects patient autonomy while ensuring I follow protocol.
What would you do if you noticed a coworker struggling with their workload? This question evaluates your teamwork and support skills in a collaborative work environment. Let's go through some helpful pointers for tackling this question. Acknowledge the coworker's struggle without judgment. Offer specific assistance by asking how you can help. Suggest ways to prioritize tasks together if appropriate. Encourage them to speak to a supervisor if needed. Follow up later to check on their workload and well-being. Let's see an example response to this scenario.
I would approach my coworker privately to see how they're feeling about their workload. I'd offer to help with specific tasks like patient care or organizing their schedule. I would suggest prioritizing tasks together and remind them it's okay to discuss workload concerns with our supervisor. Following up later ensures they feel supported.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.